There are few factors which I would like to mention here in the etiology of inflammatory bowel disease, which actually aggravate the inflammatory bowel disease recurrence. One of them is actually, stress. Second factor is your food or dietary habits. Food which is more chili or spicy, food which is fermented, food which is baked items are the people are at risk of developing the inflammatory bowel disease recurrence. Patients who are taking painkillers for variety of reason can have a recurrence of inflammatory bowel disease. Those patients who are smokers can have a high risk of Crohn's disease. So there is an association with the stress, with the painkiller, with the infection, a simple infection, whether it's a bacterial or viral, any infection of the gut can precipitate and can aggravate the patient from a silent ulcerative colitis or Crohn's disease to present clinically. So we see many patients who come to us, they say that, sir, I was all right till this time and I had a loose motion for 6 days and along with the fever. Followed by that, I have developed after 2 to 3 weeks blood in the stool. So what does it signify is that if the patient may be having a baseline ulcerative colitis or Crohn's disease which was silent or quiescent, and then after the infection the patient got a relapse of the disease and the patient presented with the symptoms which are classical of inflammatory bowel disease. So there are two terminology which medical gastroenterologist or doctor use when they treat these patients. One is a remission, other is a relapse. Now what we mean by remission is that the patient doesn't have any active symptoms and also has control of the disease endoscopically, clinically, histopathologically on biopsy and biochemically. So we call it as complete remission. So whenever we treat the patient, we focus on complete remission of the patient, means complete disappearance of the disease from the patient. So that is only achieved when we prove all these 5 parameters. So one is a clinical remission when the patient doesn't have symptoms. Second is a biochemical remission where the patient laboratory values improve, stool examination, fecal calprotectin improves. Third is that patient's colonoscopy finding shows disappearance of ulcerations and other abnormal finding. Fourth is we take the biopsies of the patient and they also do not show the inflammatory cells inside. And if these all are achieved, then we call it as a patient is now having complete remission. But if you only have a clinical symptoms disappearance and other parameters are still not recovered, then they have a potential to have a recurrence. Whereas when we call relapse to a terminology where patient who is already under medication and controlled disease has again developed the symptoms which are new onset of symptoms which are I mentioned earlier, like blood in the stool, increased frequency of stool, pain in abdomen and all those. So reappearance of the same symptoms after complete remission is called as relapse.